We are moving on to the last presentation for this session. It is on knowledge regarding methicillin resistant Staphylococcus aureus among second, third and fourth year B.Sc nursing students at 3 state universities. Authored by HUC Nuwansala and S. Suresh.
Thank you, sir. Good afternoon. Our research topic is assessing the knowledge regarding methicillin resistant Staphylococcus aureus among second, third and fourth year B.Sc nursing students at 3 state universities. Antibiotic resistant bacteria have become a significant problem in practices of medicine and nursing. One of the most troublesome bacterial strain is the methicillin resistant Staphylococcus aureus, abbreviated as MRSA. The MRSA is a global public health problem associated with considerable morbidity and mortality, especially in developing countries like Sri Lanka, because of the lack of facilities, lack of staff and Staphylococcus aureus. Staphylococcus aureus is a gram-positive coccal bacterium which is frequently found in the human respiratory tract and this on the skin as a commensal flora. This Staphylococcus aureus is not always pathogenic, but it can cause skin infections like boils and respiratory diseases like sinusitis. This organism gain resistance to beta-lactams such as penicillin, cephalosporin by producing enzyme called beta-lactamase, which cleave the beta-lactam ring and reduce the susceptibility of the antibiotics. Transmission of the MRSA may occur primarily through the contaminated hand and linen utensils. In the hospital setup, MRSA can be transmitted easily by healthcare workers when they do not follow proper infection control measures. Among healthcare workers, nurses are the persons who are in the direct contact with patients at all times. Educating nursing students about the MRSA infection, prevention of MRSA and management of MRSA is an important part of nursing education. In India, there research done and found that general awareness of level of undergraduate regarding infection control practices was quite high, and they also said when questions asked regarding details of these practices and guidelines, the level knowledge decreased significantly. In USA, one of the researcher suggests that nursing faculty and nursing education departments in hospital should provide ongoing education about MRSA to nursing students and nurses. In Jordan, another study showed that Jordanian nursing students have insufficient knowledge regarding infection control precautions. Purpose of our study was to measure the level of knowledge among nursing students at University of Sri Jayawardenepura, University of Ruhuna, University of Peradeniya, Sri Lanka. Our general objective was to assess the knowledge regarding MRSA among second, third and fourth year B.Sc nursing students in University of Sri Jayawardenepura, University of Ruhuna, University of Peradeniya. Our specific objective was to assess the knowledge regarding method of spread of MRSA and to determine the relationship between knowledge level and sex regarding MRSA, to determine the relationship between knowledge level and academic year regarding MRSA, and to determine the relationship between knowledge level regarding MRSA and teaching hospitals where they attend for clinical training. Ethical clearance was obtained from the Ethics Review Committee, Faculty of Medical Sciences, University of Sri Jayawardenepura. We obtained informed written consent from every participant before their involvement of the study. We selected Faculty of Medical Sciences, University of Sri Jayawardenepura, Faculty of Medicine, University of Ruhunan, Faculty of Allied Health Sciences, University of Peradeniya as our study setting. We selected all the undergraduate B.Sc nursing students except first year student in about 3 universities as the population. Our study design was carried out as a descriptive cross-sectional study. Sample obtained from all the second, third and final year nursing students from University of Sri Jayawardenepura, University of Ruhuna and University of Peradeniya. For collection data, we use pre-tested self-administered questionnaire to cover the knowledge regarding MRSA, and the self-administered questionnaire include questions under 2 sections. Those are section A include demographic data which are age, sex, academic year and teaching hospital where they are attending. Section B include questions to assess knowledge like regarding organism and regarding preventive measures. Data collection method. Prior permission for study was obtained from 3 faculties. Written informed consent was obtained from the volunteer students. The self-administered questionnaire was administered to the participants during their lunch time or leisure times. We analyze our data by using descriptive statistics using SPSS version 16 as a data analytics tool. Inferential analytics was done by using Pearson chi-square test of significance. These are our results. Nearly 34%, sorry. We collected data about frequency, about media getting information from MRSA. Most of the students had used more than one media to get information, and nearly 27% students had used other media except the ones mentioned above, like internet, research articles. This is the distribution of knowledge level. Nearly 63% participants had good knowledge, and nearly 30% had nearly 63% possessed good knowledge, nearly 30% had poor knowledge, and nearly 6% participants had poor knowledge. We checked the relationship of knowledge level and the sex. There was no significant association between sex and knowledge level regarding MRSA. We also checked the relationship of knowledge level and academic year. most of the fourth year student process good knowledge level, nearly 63%. There was a statistically significant association between academic year and knowledge level regarding MRSA. We also check relationship of knowledge level and teaching hospital where they attending for their clinical practices. There was a statistically significant association between knowledge level and teaching hospital of clinical training. Conclusion: according to the finding of this study, the majority of the participants possess good knowledge about MRSA. Excellent knowledge was observed in high in fourth year students. There was a correlation of knowledge level and academic year and teaching hospital of clinical training. Recommendation: we recommend continuous learning sessions and practical programs for all nursing students, especially focus on new knowledge and practice can be introduced, and orientation programs for all students to understand the hospital function and policies are recommended. Conduct a research study to assess knowledge, attitude and practices regarding MRSA in all B.Sc nursing students in Sri Lanka. These are my references. We acknowledge deans of 3 faculties for granting permission and participants of University of Sri Jayawardhanapura, University of Ruhuna and University of Peradeniya. We also acknowledge for kind assistance for B.Sc nursing program in Department of Allied Health Sciences, Faculty of Medical Sciences, University of Sri Jayawardhanapura. And for valuable comments from academic staff, Department of Community Medicine, University of Sri Jayawardhanapura. Thank you.